Good morning, everyone. I am Dr. Shaktivel, Assistant Professor, Department of Community Medicine, Meenakshi Medical College, Hospital and Research Institute. Today, we will be discussing about a most important communicable disease named tetanus. Tetanus is an acute disease which is induced by the exotoxin of Clostridium tetani. It is clinically characterized by muscular rigidity which persists throughout the illness, which is punctuated by painful paroxysmal spasm of the voluntary muscles, especially the masseters, that is the tritrismus or lockjaw. The facial muscles, when involved, it is called as ramus sardonicus, and the muscles of the back and neck, when involved, is termed as opisthotonus, and those of the lower limbs and abdomen are also termed as opisthotonus. The mortality tends to be very high, varying from 40 to 80%. This is a classical sign of ramus sardonicus, where you see the flexion of facial muscles. Here you can see the rigidity of the back muscles, which is characterized as opisthotonus. So as we already know, in any communicable disease, you follow epidemiological triad, that is the agent, host and the environment. Here the agent is nothing but the Clostridium tetani, which is a gram-positive anaerobic spore-bearing organism. So you can, in this picture, you can see the image of a Clostridium tetani with spores at the end. The reservoir is soil and dust. We already discussed the exotoxin of the tetanus is the culprit. The toxin acts on four areas of the nervous system: the motor end plates in the skeletal system, the spinal cord, the brain and the sympathetic system. Period of communicability. There is no period of communicability since this disease is not being transmitted from person to person. Host. Commonly, tetanus is a disease of active age. That is, people in active age tend to work more, play more. They tend to get exposed to the dust where the Clostridium tetani is hosted. Hence, age is a major host factor. Sex. Generally, females are more exposed to the risk of tetanus, mainly during the delivery or during the abortion, which leads to puerperal tetanus. Mainly agricultural workers and coal workers are at the higher risk of getting tetanus, and people living in the rural area have a higher incidence of tetanus when compared with urban area, and people with lesser immunity or no immunity will be higher exposed. Environmental and social factors. Its occurrence depends upon the man's physical and ecological surrounding. The soil, the agriculture, animal husbandry. Why animal husbandry? Because tetanus can also be hosted at the cow dung and not in the presence or absence in the infection of the population. Unhygienic customs and habits, as we see in the puerperal tetanus, ignorance of infection and lack of primary healthcare services. What are the modes of transmission? The tetanus infection is acquired by contamination of the wound with tetanus spores mainly, which includes trivial pinprick, skin abrasion, puncture wounds, burns, human bites, and unsterile surgeries. Incubation period generally lasts between 6 to 10 days. However, it may be as short as 1 day or as long as several months. What are the types of tetanus? You have traumatic tetanus, puerperal tetanus, autogenic tetanus, idiopathic tetanus, and tetanus neonatal. Traumatic tetanus. This is the kind of tetanus where the host is being exposed to the tetanus bacilli because of any trauma. Puerperal tetanus happens during the delivery. Autogenic tetanus. Sometimes what happens is trivial pinprick or some kind of instrumental prick can happen to the ears, through which autogenic tetanus can also be a cause. Tetanus neonatal, idiopathic, that is of no unknown etiological origin, and tetanus neonatum is for the children with tetanus. Problem statement. Maternal and neonatal tetanus is an important preventable cause of neonatal and maternal mortality, particularly in developing countries like India. The spores of tetanus are very resistant and remain in the environment in the extremes of the temperature for a longer time period. Hence, technically, it is not at all possible to eradicate tetanus, including neonatal tetanus. However, the disease is highly preventable. How? We can follow clean delivery and umbilical cord practices to ensure infection is not contracted by mother or newborn during the delivery process. Delivery of appropriate doses of tetanus toxoid to the pregnant woman through antenatal care services and other routine contacts is necessary. Vaccination campaigns with tetanus toxoid targeting all women of reproductive age in higher risk areas and strengthening surveillance to identify women at risk. Reasons for the risk and potential clustering needs to be done. What about the maternal and neonatal tetanus elimination in India? Acceleration of tetanus toxoid immunization coverage through the World Health Organization recommended high-risk approach, systematic vaccination of pregnant women attending antenatal care with tetanus toxoid vaccines, promotion of institutional deliveries and avoidance of domiciliary deliveries, reduce harmful cord care practices like applying cow dung, turmeric, mud over the cord. And when coming to the vaccination part, you have two preparations are currently available for active immunization. One is the monovalent vaccine and the other one is the combined vaccine where tetanus toxoid is being combined with DP. D stands for diphtheria, P stands for pertussis. So you have the availability is in form of plain or fluid formal toxoid or tetanus vaccine is absorbed. Combined vaccine. At present, we have pentavalent vaccine and we are giving pentavalent vaccine at 6th week, 10th week and 14th week, and you are also giving DPT vaccines as a booster dose, 2 booster doses. Fine. What are the combination of pentavalent? DPT is added along with H influenza B and hepatitis B. The use of monovalent vaccine. Purified tetanus toxoid has largely supplanted plain toxoid because it stimulates a higher and longer lasting immunity response than plain toxoid. 2 doses of tetanus toxoid absorbed, each dose of 0.5 ml injected into the arm given at interval of 1 to 2 months. It is always better to follow a longer interval period to get a higher effect. What are the recent updates? Now we are not at all using tetanus toxoid, that is TT. We are following TD, that is TD vaccine is a combination of tetanus and diphtheria with lower concentration of diphtheria antigen. The Ministry of Health and Family Welfare recommends the replacement of TT vaccine with TD vaccine for all age groups including pregnant women. TD, that is tetanus diphtheria, is a freeze and heat sensitive vaccine. OPV, that is oral viral policy, is applicable for TD vaccine and shake test is also applicable. What is open vial policy? Open vial policy, under this policy, the vaccine once opened can be used in the subsequent programs or camps for a limited time period with certain rules, restrictions and regulations. TT, OPV, DPT, hepatitis B, Penta and IPV are the vaccines which comes under open vial policy. What is shake test? Prepare a frozen control vial that is the same type, batch number and from the same manufacturer as the vaccine you want to test. Because it can be done when in doubt whether the vaccine has been expired or not. Freeze the control vial until it is rock solid. Thaw the control vial for 20 minutes and shake both vials to mix the sediments. After 15 minutes, compare the contents of 2 vials. If the vaccine in the test vial is not uniformly mixed or if there are any sediments at the bottom, the vaccine has been discarded. It should not be used. So how can you prevent neonatal tetanus? By 5 cleans. Clean hands, clean delivery surface, clean cord care, clean blade for cutting the cord and clean tie for the cord and no application of sand, mud, dung or any other substances on the cord stump. So what are the strategies for prevention of tetanus after injury? So we have 4 categories. A category are the people who has had a complete course of toxoid or booster dose within the past 5 years. People coming in the B category are people who has had a complete course of toxoid or a booster dose more than 5 years but less than 10 years. Category C people are the people who has had a complete course of toxoid or a booster dose more than 10 years, and category D people are unaware of their immunization status. So you have 4 categories. When all wounds should receive surgical toilet, that is cleaning, and wounds less than 6 hours old, clean and non-penetrating and with negligible tissue damage. If a category A person comes, nothing more is required. When a category B person comes, you have to give them a single shot of TD. When category C person comes, you have to give them a single shot of TD. Whereas when a category D person comes, you have to complete the TD dosage, that is 0.5 ml for 2 dosage within a time span of 2 months, 1 to 2 months. Any other wound penetrating more than 6 hours and with wounds with negligible more tissue damage, when a category A person comes, then also nothing more is required. When a category B person comes, you have to give them a single shot of TD. In category C, you have to give them a single shot of TD along with human tetanus immunoglobulin. Whereas in category D, you have to follow the complete course plus along with the human tetanus immunoglobulin. So to summarize, tetanus is an acute disease induced by exotoxin of Clostridium tetani. The natural habitat of the organism is soil and dust. It is not transmitted from person to person. Clean delivery and umbilical cord practices can prevent the disease. Ministry of Health and Family Welfare recommends the replacement of TT vaccine with TD vaccine for all age groups, including pregnant women. I hope this class was useful. Thank you.